Hi, I'm Janine Cody, and welcome to the third of 10 short videos addressing the frequently asked questions that I get about chromosome 18 abnormalities. So in the first two videos, we talked about what a chromosome abnormality, a chromosome variation is, and learned that they're very, very small. And in the second one, we learned that when you start looking and including the ones that are very, very small, we all have them. We all have more than one, probably. So what does that mean, and how do we know which affect health and which do not? So the first obvious question, or a possible answer, would be, well, maybe it's just the size. So if you look at the population frequency, you could imagine that there's going to be a whole lot of them that are normal variation. And maybe a smaller number that are involved in disease risk factors. You know, we hear in the news about conditions like Parkinson's or Alzheimer's or autism having a genetic basis, but that basis is due to multiple genes that are risk factors and not a single gene necessarily that is the cause. So you can imagine the changes, the structural variations in chromosomes that are those risk factors might be a little less common in the population. And then the ones that cause an outright disease or developmental delay or something that's really life-affecting, that those are the very rare ones. And you might then also assume that the ones that are really, really common are really, really little. And the ones that are risk factors are the medium-sized ones. And the ones that cause disease are huge. So the size is inversely related to the frequency in the population. Well, I'm here to tell you that is not necessarily true, and let me show you with an example from our own work. Here we have a young lady, a teenage girl, who has a very small deletion. Really, it's 100,000 base pairs, but pretty small, and involves one single gene. And this teenager's developmental age is that of an 11-month-old. So she doesn't efficiently feed herself. She's not walking. She's not potty trained. So one gene, and she's really pretty profoundly affected. Here's another teenage girl, about the same age. Look at the size of her deletion indicated by the red box. The deletion in this case is 60 times bigger. It includes 27 genes. This teenager has an IQ of 120. It doesn't mean she doesn't have some other issues with some hearing impairment or foot abnormalities, but intellectually she's doing quite well. And so from this we learn, of course, that it's the genes that matter that are included, and not just the size. It's the content that matters. And so the next videos we're going to explore, how do you unravel the content and what matters and what does not. So stay tuned.